Okay.
You should always like
I know, I'm kind of surprised you don't have fluffy socks. Did you forget those at home?
In the car.
So I think next week Karina's going to have fluffy socks too. So
Rabbit ears.
call it a muscle. What muscle do we want to stretch in our lower extremity?
Hamstring.
Hamstring. Okay. So a couple different ways to stretch our hamstring, right? So there's this one. It's everybody's first go-to. What else does that quote-unquote stretch?
Well,
Hamstring. The
gastroc,
If you feel it in your gastroc, if I'm supporting her here, what am I actually stretching?
soleus, or
It's probably her sciatic nerve.
sciatic.
oh,
Yeah, she
really?
has
Because
sciatic.
am I really adding
Oh,
this, right? If
okay.
she's like, oh, I feel a stretch, you say where?
Sciatic.
And she points here,
Mhm.
that's probably more her nerve. That's
Like-
more neural tension.
That's like the SLR test.
That is an SLR test. Your true SLR
I failed.
starts here.
Yeah, he filled it. And he filled it.
You failed it? Here.
No, I just wasn't able to pinpoint sciatic. I said
I
femoral.
said sciatic syndrome, and I keep telling
Oh,
you.
so your femoral nerve is on the top part of your leg, so that,
I know.
would be pretty wrong.
I know. Dr.
If
Risby
it's
said
tibial, you might gotta
it
leave.
becomes. It's just one nerve that changes name as it goes down, something
So
like
your
that.
Yeah.
sciatic becomes your tibial nerve and your deep and superficial peroneals. It does
Right.
not become your femoral. Your femoral comes along the front.
That's what I made a mistake.
If you
in.
said femoral, then I would agree you probably failed that one. If you had gone like tibial or peroneal, I'd be like, well, technically I can't say no. But that is true, right? So if they get neural tension with that, then you could come into this 90-90 position, right? And you could stretch them here. Because now I can isolate more hamstring. So especially in any of your population that has complaints of back pain, this one is not going to be my choice. If they come in with a diagnosis of back pain, this would more be my choice. Okay? And a lot of times when they're first coming in for back pain,
Both.
this would be my first choice. Okay? Because now her back is stabilized and neutral. Now I can really just kind of focus in on her hamstring. Because do nerves stretch? No. Nerves are like dental floss. Anybody ever got dental floss stuck in a little spot in their teeth? And you pull really hard? How'd that feel? Not so good, right? Your nerve feels the same way about that sensation. Nerves floss back and forth. When they got a hang-up spot, that part grabs onto it and you're trying to stretch it, it gets a little angry, okay? Muscles are elastic bands. They don't mind stretching. Stretch them, they come back. If you overstretch them, they might snap like an old elastic band. Okay, so try not to do that. That's more what your patient might do to themselves. So other food for thought when you're talking to a patient, if your patient's like, oh yeah, it's a really good stretch, and I can only hold it for like 5 seconds. Is that what you want? No. So always tell them, instruct them, especially, nothing personal guys, especially your male patients. There's something about, they feel like if they don't feel it, they don't really feel it, they must not be doing anything. So you gotta a little bit break that mentality. Be like, we want a medium stretch, something you could hold for like a minute. You could sit there, you could watch TV, you're not sweating when you're stretching. Okay? That's a little bit different, that's yoga. Okay?
Right.
If you're just doing a light stretch, you should be able to have a conversation, play some video games, brush your teeth, all of that kind of stuff. Okay, so that means you're lessening the load of the stretch, so you can hold it for a longer duration. That's some of the stuff that Professor Davies was talking about, what you guys were all sleeping. Okay.
Thank you.
Totally.
It is a very long day. You guys at least get to just absorb. You don't have to talk for like 8 hours straight. So how would you give your patient a hamstring stretch for home? There are many different options. Javier, you get to go first.
You can use a towel, right?
You could use towel. I don't have any towels here. I know there's some over there, but Javier's going to show us one.